Bakit tayo mag-granular lockdown sa panahon na mataas ang kaso ng COVID-19 sa Metro Manila? So, Director De Guzman.
Folks, magandang tanghali po and sa lahat po ng nanonood nakikinig, good afternoon. So ito pong policy shift no na pinag-uusapan natin ay it came from the analysis of our data showing that whenever we put these areas under lockdown, pag tiningnan talaga natin, yung 80% ng mga bagong kaso po natin ay actually hindi naman po sa lahat ng barangay ng buong syudad or buong munisipyo. Base po sa nakita natin sa NCR, naglalaro lamang from 11 to 30% of our barangay are actually contributing to 80% of our cases. Ikalawa din po, nakikita natin na ang mga ECQ, ang MECQ natin ay panandalian lamang. It's really there to be implemented temporarily and is there to buy us time para po lalo pa natin ma-improve ang ating mga public health and critical care capacities. At liban po sa pag-impose ng mga ganitong restrictive wide-scale lockdowns, meron pa tayong 3 major strategies na dapat po nating i-implement at i-enhance dahil sila po yung ating core strategies to reduce the numbers. The first is our adherence to the minimum public health standards. The second is improving our health system capacity. And this is defined right now as shortening the interval from case detection to isolation to just under 5 days. And the last po is our vaccination coverage. Our projections done by our partner FASTER showed that even at lower community quarantine levels, if we improve these 3 strategies, halos yung epekto nga po ay halos katulad na po kung tayo nga po ay nag-ECQ. So this is our way to balance health and economy. We want to be able to reduce cases but at the same time safely open up our sector so that people can continue working.
Ma'am, earlier you mentioned na yung 80% of cases in Metro Manila come from a few barangays. What is it about these barangays which led to so many cases?
Yeah. Yung ating basihan ngayon ay yung dami ng kaso. No? At nakita natin yung 11 to 30% of this barangay are actually the larger barangay. No? So parang intuitively, if you have a larger population, you'll really have a larger number of cases. Pero tama ka din, ito ngayon na yung feedback natin sa ating mga mayor para alamin, ano ba yung pwede natin gawin para even if they have large populations, they can still markedly reduce their cases.
Mm-hmm. And then sabi niyo rin earlier that improved compliance to health protocols, quicker isolation after detection is just as good as ECQ. What's the data to prove this?
This was based on the projections done po by FASTER. No? So wherein we compared paano kung naiwan lang tayo ng ECQ but we have no improvements, we just stayed yung baseline lamang, yung performance sa 3 metrics na to. At paano kung ibinaba natin ang ating scenario to just an ECQ, MECQ, followed by GCQ. But we improved these 3 performance metrics. At nakita natin mas maliit ang dami ng active cases natin with a lower CQ level but very significant improvements in these 3 metrics. At dagdag ko lang, even when we de-escalated from ECQ in the previous spikes, we were actually to continually push down our numbers even though MECQ na tayo or GCQ with heightened restrictions. So those are some of the information we have that supports that statement.
Mm-hmm. And lastly, is the DOH recommending for this concept of granular lockdowns that the lockdowns will apply only to residential areas? For example, like malls or yung mga hubs where businesses operate. Will they be exempt from those hard lockdowns or could they also be locked down? And in what scenarios yun?
Yeah, actually yung lockdown, granular lockdown, matagal na natin ginagawa to. Ito yung nabanggit ng NTF na containment strategy. Kung saan pinakikita niya, pwedeng as large as a barangay, but what we're recommending is we can scale it down. If you have to do just a house lockdown, a street lockdown, then do so. But yes, pwede rin naman kasi mga establishments. Paano?
Nawala Dr. De Guzman.
following the previous criteria natin ng pag-lockdown. Pero yung policy shift natin na yun, ngayon nga yung pina-finalize, it talks about restrictions at a sectoral level po. So those are a bit different from the granular lockdowns that we're talking about.
Okay. In what sense different? Sectoral, meaning no difference?
No, the sectoral, I think it was previously announced. It talks about the closed spaces, the crowded places, and where there's higher risk of transmission. At yun nga yung kasama na pina-finalize sa ating guidelines. So we'll give a feedback on what those specific provisions are once it's approved by IETF.
All right. Thank you.